Hello, I'm Dr. Valerie Walker, and welcome to another medical moment where we come into your home trying to give you good advice on how to live a long and healthy and fruitful life. Tonight, we're going to talk about something really different, and that is something you need to know. So you may want to go get a little piece of paper so you can write down these tips. I'm going to give you the 7 warning signs of cancer. Did you know that when you drive in a car right before it puts you down on the interstate with tractor trailers rolling past you doing 100 miles an hour, the body warns you just like that car. Before that car gave out on you on the interstate, it did a little rattle here and there, it did a little knocking, it did something to let you know that it need to go to the shop. Well, what did you do? You do like most people, you ignored it and you kept going until you was broke down on the side of the highway as cars just whisked past you and nobody stopped to help. Well, the human body is the same way. Before it does something really drastic, if you pay attention to your body, and you always got to listen for the little subtle signs and symptoms that the body will send your way to let you know that something is wrong. So we're going to do tonight the 7 warning signs of cancer. And number 1 on our list will be a sore that will not heal despite all your good efforts. Now, let me just clarify something here. Sometimes patients that have diabetes and all, they can have sores because of poor circulation and ulcers on their feet and stuff that they have to get treatment for. But that's not what I'm talking about. I'm talking about a sore that you look at day in and day out. You see it's not getting any better. You put a little topical antibiotics on it. It's just not healing at all. You need to call your doctor and show your doctor, let them take a look at it and see if it needs biopsy, a new treatment or something. But a sore that just absolutely will not go away despite all of your good efforts, and I'm making sure you put some good effort in there, that you call your doctor and let them take a look at it. So number 1 on our list of the 7 warning signs of cancer is a sore that will not heal. Number 2, and this is a big thing, is bleeding from the rectum. We know colon cancer is on the rise, especially in young people. Guess what? We've lowered the age. You used to have to get your colon test if there were no family history of colon and no big risk factors, or you had suspicious looking polyps before 50. We used to say start our colonoscopies at 50. But we're seeing so many young people. It's unbelievable. With colon cancer, the new age now is actually 45 years of age. So if you have any kind of rectal bleeding that you can identify, sometimes there are things that don't always have to be cancer. It could be bleeding, hemorrhoids, and other things that can make you bleed from the rectum. But for sure, this is something you want to get on the phone, call your doctor, make an appointment, and make sure they check it out to make sure it's just not hemorrhoids and not nothing else serious going on, especially over the age now of 45 and not 50. And the third thing we want to talk about is moles. A mole that changes, a mole that's not staying the same. A mole should actually look like a pencil head with an eraser on it that you've never used before, and you know how round and perfect that pencil look. Well, a mole that changes in asymmetry, meaning it's just all kind of weird shapes. It changes colors. It could be black, green, red, blue, just all the colors in the rainbow and all, and it's growing and it's changing. You want to get that mole looked at right away. The worst thing it could be is something like a malignant melanoma or facial moles that turn into what we call basal cell or squamous cell. You just any mole that changes and not symmetrical, smooth, same color, just get it looked at. And it'll be a good thing when you get your annual physical, and I'm hoping you're doing that also, and you have a mole, just let the doctor look at it and let them be the judge. But for sure, a mole that's changing and turning colors and asymmetrical and the diameter and all is changing, you want to get that checked out. So that's another warning sign of cancer, is a mole that is changing on you. And the other thing is a persistent cough, especially if you smoke cigarettes and got that old hacky smoker's cough. But this cough is just persistent and won't go. Most smokers will cough a lot in the morning when they first first get up and all, but this is that cough that you just coughing all the time. You've been smoking for a long time. You haven't had a recent chest x-ray. You haven't talked to your doctor about it. Please go talk to your doctor, because like I said, smoking can affect any part of your body, especially the lungs. However, smoking, because the smoke goes throughout the body, it can hit you in the esophagus, it can hit you in the stomach, your bladder. Smoking can trigger cancer anywhere. So the best thing to do for smoking is to quit and talk to your doctor. If you're really serious and want to do it, because only you can stop smoking, is talk to your doctor about it. But for sure, if you got a cough, persistent, that will not go away, you want to talk to your doctor about that. Other thing you want to talk to your doctor about is unusual vaginal bleed. Now, if you've gone through the menopause and you 60 or 70 years old and you start seeing blood again, no ma'am, you have not returned to your childbearing age. That has not happened. You want to get that checked out, because bleeding from any orifice is bad, especially when you're what we call postmenopausal, meaning you've gone through the menopause and now you're seeing blood. Go and talk to your doctor about it, because chances are it's not going to go away. We call that postmenopausal bleeding. You want to report that right away to your doctor. And the other thing you want to report to your doctor is a discharge from the breast. A discharge, unusual pain in the breast. I've had a lot of ladies tell me that turn out later on to have breast cancer, that their breast was just itching a whole lot. They said, Dr. Walker, I just had all this itching in my breast. But you want to have any kind of discharge, any kind of lump, and you want to feel your breast. You know, don't be ashamed if you're in the shower, just to raise your hand and run your hands over your breast in a clockwise way. Your doctor can always show you how to do that. The bulk of a lot of breast masses actually are found by the patient. So you really want to check those breasts on a regular basis, at least once a month. You want to check them for discharge. So any discharge from the breast, call your doctor right away. Any lump in the breast, call your doctor right away. And you want to get in the habit of checking your breast, because if you check your breast on a regular basis and you feel something unusual, you'll know it's unusual, because you'll say to yourself, I've been checking my breast all these years and I've never felt this before. So make sure you get familiar with your own body and don't be afraid to touch your body. And the other thing that you want to look out for all the time is a sore throat, because smoke actually burns going down the little fragile cells that we have located throughout our body. So if you got a sore throat and it just will not go away, and you've gobbled, you've done this, you've taken rounds of antibiotics, this is something you really, especially again, if you're a smoker, smoking does so many horrible things to the body. So that's something you really want to get checked out. So those are the 7 warning signs of cancer. You may ask, what is cancer? Cancer is when the cells just don't, it's a thing called contact inhibition. When normal cells touch each other, they stop. It's like when you get on the elevator. Have you ever noticed when you get on the elevator, everybody move to the side somewhere, they get out of your way? Well, with cancer, the cancer cells do not have contact inhibition. They touch each other, just keep on growing. That's why you'll hear a doctor say the cancer has spread and that we have to stage it. So before we get to all of that bad part about it, the best thing to do is 1, get your annual physical, 2, report any unusual moles, any unusual bleeding from any orifice, any cough that won't go away, any rectal bleeding, anything unusual. Don't just sit up there when the doctor asks you what's going on. Nothing. There is something going on, and you have to know. A lot of us run from the truth, but you can't run, because guess what? None of those things are going to go away, and you want to catch it. The key word with cancer is to catch it early. The earlier we catch it, the more we can do about it. Don't come and have had symptoms for 5 years and then turn up when we got to tell you that not only is it cancer, that it has spread. Well, research has come a long way with cancer. We can do a lot of things, but we can only do these things if we can catch it early, and not you coming in years and years and years later. The biggest thing you can do for your health is exercise, eat right, and for goodness sake, lay those cigarettes down. This has been Dr. Valerie Walker with the Medical Moment, and we'll see you next time.